then I was told, oh, that's the dietary guidelines for hospital patients, even if diabetes, to have ice cream up to 3 times a day, desserts, morning tea, afternoon tea, chocolate cake, biscuits, snacks, breakfast cereals, and then breakfast full of sugar, lunch with dessert, dinner with dessert. And those guidelines are still there. So I've actually challenged, I've actually spoken at the National Food Guidelines, and I've given a lecture with their own documentation, and they said, no, that's not possible. So I just take out the parts of it and say, here it is. This is the dietary hospital food guidelines for inpatients in hospitals in most states of Australia. A couple are starting to modify that, but if you've got type 2 diabetes, you can have ice cream up to 3 times a day. Is it any wonder we're out of control? So in the process of that, I started challenging the system. I started looking into nutrition way beyond what we get in our own education, which is close to zero, or completely conflicted at the very least, which is, what's happening right at this point in time. And then found that, cut a really long story short, I came up with this nutritional model of modern disease. And I'm proudly the first person to describe that we know of, that the combination of sugar, refined carbohydrate, and polyunsaturated oils creates a perfect storm of inflammation, and inflammation sits behind all modern disease. And hence, everything's out of control in society from a health aspect, as well as most other things.